Khanna, a senior consultant orthopedic surgeon and joint replacement surgeon at the South Mumbai unit of Wockhardt Hospital. Today we have a very exciting topic that we're going to be talking about, and that is on robotic knee replacements. As all of you might be aware, there is a huge hype about knee replacement surgery, and more important than knee replacement surgery, now you have the option of doing a knee replacement surgery in a conventional manner. You can do a knee replacement surgery with using computer assistance or computer navigation. Plus now you can also do the surgery with a robotic method. So a lot of us have doubts, is robotic knee replacement really superior or better compared to a conventional knee replacement surgery? So my job today is to explain to you what a robotic knee replacement surgery really means. Is it the robot that does the surgery for you, or is it still the surgeon who does the surgery for you, but the robot helps the surgeon in ensuring that you're able to do the surgery better? Okay, so going back, what is a robotic knee replacement surgery? And we're going to be talking about what is a robotic knee replacement surgery using the Stryker Mako robot, which is an image-based robotic system. Image-based robotic system essentially means that you do a pre-operative, which means before the operation CT scan of a patient, before you plan the surgery for that patient. The biggest advantage of this is that the pre-operative CT scan actually gives us all the information that we need to know about what is the structure, what is the anatomy of the knee of the patient we are operating. And since we have all this information before we even start the surgery, we are able to plan the surgery before we actually take an incision or a cut on the knee. So, utilizing the pre-operative CT scan, we can precisely know before starting the surgery what is the size of the knee that is going to be used, how much of bone we have to resect and from which area to be able to correct the alignment, which means correcting the bent knee to a straight knee. And all this information allows us to prepare a pre-operative plan prior to actually starting the surgery. The better part of this is that as we start the surgery, we have a camera that communicates with the patient's knee and gives us real-time information, which means the background information that we have had is clubbed with the real-time information during the surgery, which means we can now fine-tune our plan to give the patient a personalized knee which is best for his kind of native knee anatomy. Every patient may have a different knee, so a same plan for every patient may not work. That's how robotic technology helps us in giving better outcomes. So the first essential element of a robotic knee replacement is precision. We are able to accurately place the components for that patient's knee anatomy in the way we want to place those components. Now, the second important criteria for doing any surgery for a surgeon is to ensure safety, which means we want to make sure that in an attempt to make a patient better, we don't end up making the patient worse. So safety becomes a paramount or the most important criteria before performing a surgery. The Mako Stryker system has an AccuStop specific technology built into it, which is a haptic boundary, which means if we try to cross that boundary and enter into a structure which we should not be entering into, the haptic boundary will not let us enter into that area, which essentially means that it is safer than performing a traditional knee replacement because the saw or the robotic arm which is held by the surgeon in his hand will not be allowed to go beyond the boundaries of safety. So two things, I go back again, we get precision, we get accuracy, we get safety. Plus we get the benefit of the data analytics, which means all the data that we capture on the pre-operative CT scan, all the data that we capture on the intra-operative period through the camera interacting with the patient is recorded, is smartly analyzed by the computer, and the computer and the surgeon then reach the best plan of treatment, the best plan of care to give an accurate, precise and safe option of a knee replacement surgery for that particular patient, which is unique to that patient alone. It is no more about one size fits all, it's about what fits your size best. That's the advantage of a robotic knee replacement with regards or in comparison to a conventional knee replacement that is done traditionally. मैं छोड़ दूं आपका हाथ, आप चल लेंगे? गिरेंगे नहीं? पक्का?
बिल्कुल।
ओके, तो आप चलिए। Excellent, you are walking superb. Very good. Okay, तो 2-4 सवाल पूछ लें। आपका ऑपरेशन कब हुआ?
16 तारीख।
तो आपका दूसरा ऑपरेशन 16 तारीख को हुआ, कौन से घुटने का?
ऊर्जा करते हैं।
ओके, और आज हुई 20 तारीख। आप बिना सपोर्ट के चल पा रहे हैं?
हाँ।
आपका घुटना अच्छे से मुड़ रहा है? अच्छे से सीधा हो रहा है?
एकदम अच्छा।
आपको कोई बहुत ज़्यादा तकलीफ हुई ऑपरेशन के बाद?
नहीं।
आप कंफर्टेबल रहे? आप कुछ अपना एक्सपीरियंस शेयर करना चाहेंगे लोगों के साथ, क्योंकि आपकी रोबोटिक सर्जरी हुई, नॉर्मली हम लोग कन्वेंशनल सर्जरी करते हैं। आपको क्या लगता है कि आपके दोस्त लोग, आपके जान पहचान में किसी का हुआ होगा ऑपरेशन, आपको लगता है कि आपका दर्द उनसे कम है, उनसे ज़्यादा है? आपको क्या लगता है?
हम बोलेगा सब अच्छा ऑपरेशन हो गया और दर्द भी कम हो गया, एकदम अच्छा है।
थैंक यू वेरी मच। अब हम एक बार वापस वॉक करते हैं आपके साथ। ओके, चलिए, मेरा हाथ छोड़ दूं?
छोड़ दो।
आप अकेले चलो।